Hi, my name is Bianca Turner, and today I'll be discussing a policy proposal to reduce childhood obesity rates in America. First and foremost, to start by defining obesity. According to the CDC, Centers for Disease Control, obesity is defined as a medical condition in which excess body fat has accumulated to the extent that it has negative effects upon health. Childhood obesity is a serious problem in the United States. According to the CDC, between 2011 and 2014, the prevalence of obesity was among 8.9% 2 to 5 year olds, compared with 17.5% of 6 to 11 year olds and 20.5% of 12 to 19 year olds. Childhood obesity is also more common in certain populations. Obesity in children can be extremely detrimental to their health, and their needs must be addressed because it could lead to many chronic diseases and illnesses like high blood pressure, type 1 or type 2 diabetes, and certain cancers, and much more. So my policy proposal will address, first and foremost, the social and economic factors that contribute to obesity in children, followed by food policies and changes that should be implemented into public school systems and communities. What are the costs of implementing this policy and the potential risk factors associated with implementing my policy? So first and foremost, the social and economic factors would be poverty. Many poor families have limited budgets, which gives them limited choices as far as food consumption. So they're more inclined to buy more affordable foods that last longer, like processed meats, refined sugars, potatoes, starches, versus those that are healthier, like fresh fruits, fresh vegetables, lean meats, and fish. Also, in these disadvantaged neighborhoods and communities, healthy food options are hard to find. Like large supermarkets, fresh markets, organic farmers markets are hard to find versus fast food places or corner stores that sell the cheap, high fatty processed foods. So in these communities, majority of the money goes to paying bills, rent, insurance, versus the foods that they consume. So there's less stress upon bills, but however that negatively affects the food that they eat. Also with this, another factor, social and economic factor, would be education. Not knowing what foods are healthy, which ones are not healthy, what choices to make. This can, another factor could be transportation. Again, accessibility to these fresh markets, to these large supermarkets that have more options. For an example, growing up, we had a corner store that was right across the street. It was so easy for us to go get a bag of chips and soda because it was convenient, it was fast, it was $1 and some change versus these large supermarkets. As a child or a teenager, we don't have cars, we can't get to these places, so I was more inclined to go to these fast food places, these corner stores that sold the really high in fat, trans fat, salty, processed foods. So some of the food policies that should be implemented, again, in our school systems, our recreation centers, child daycare centers, anything community-based dealing with children, these food policies should reflect increasing the prices of healthy food. So the fast food places, prices in the corner store or 7-Elevens, these small mom and pop shops, increasing the prices of these unhealthy foods and decreasing the price of healthier options like fruits and vegetables, whole grains, whole grain based snacks, or natural sugars, organic, lowering these prices so that people are able to purchase them versus the cheap fatty foods. Again, with the local childcare facilities, they can house healthier food options, whole grain goldfish, zero trans fat foods, organic sugars and apple sauces, things like that, or natural juices versus artificial flavor, Kool-Aid, things with high sugar. Also, with these public facilities like recreation centers, like gyms, removing vending machines or replacing the foods in vending machines with healthier options. For example, having low calorie, low sugar, no carb, zero sugar energy drinks versus having the standard Red Bulls and Gatorades. So the outcome of this, proposing this policy, people will be healthier. They'll be more knowledgeable of their health risks and the associated health risks, like the long-term health risks. Enacting this policy would change the dynamic of local businesses. For example, the local corner store, if you implement these policies having higher taxes on fast food, lower taxes on healthier options, the dynamics change. You're more inclined to see fruits and vegetables in the front of the store, more appealing, versus the soda and the chips in the front. So again, you could also implement these in the community by starting in the schools. Schools play a huge role in supporting healthy lifestyles, physically fit lifestyles. So things like extending the hours of physical education, physical training would help with the reducing the rates of childhood obesity. Also making physical activities more appealing, games like Capture the Flag or relay races. These things appeal more to children and get them more active, advocating joining a sports team or an active, physically active team at the school versus not getting involved at all. Also in the schools, you can implement salad bars that have lean meats or more variety in fruits and vegetables, making them more appealing, having creativity in these fruits and vegetables, and again, having lower prices in these salad bars. I've seen this implemented in my high school. In my freshman and sophomore year, we didn't have a salad bar, but my junior and senior year, we had a salad bar, and the lines were always long because it was cheaper than having the processed foods of the normal day-to-day lunch line. So according to the CDC, the percentage of children with obesity in the United States has more than tripled since the 1970s. Today, about 1 in 5 school-age children ages 6 to 19 are obese. So again, starting in the schools where there are more immense amount of children, starting in the schools, supporting healthier lifestyle and daily activities will definitely improve the overall health and contribute in decreasing these childhood obesity rates. So the behavior of legislative, these are our children in these communities. So we need to stand up and have them make better choices. So according to the healthieramerica.org, as a result, we spend on an estimated $190 million every year to treat obesity-related conditions, with childhood healthcare costs rapidly increasing that number. So ultimately, we will save money having healthier options in school and our communities, implementing these policies, taxing unhealthy foods, and decreasing the taxes of healthy foods. And the importance of this message is to get local, state, national governments involved and take action. Because again, these school system, communities, recreation centers, these are crucial systems to our communities and outreach to our children. So it's really big that we get involved and we change the dynamic of the consumption of food in our communities. Again, another statistic from healthieramerica.org, more than 1 in 4 17 and 24-year-olds in the United States are too heavy to serve in the military, a development that retired military leaders say endangers the nation's national security. So, again, reducing these childhood obesity rates, more people can join the military and defend our country. So, again, change isn't always easy. However, this is something that we must act fast on to save our children and to lower these childhood obesity rates nationwide, worldwide, and stop the epidemic of childhood obesity and long-term chronic illnesses. Thank you.